Hello, everyone. Good morning. All the people, doctors in India and probably abroad too, for joining this session, this webinar. Calm doctors, save patients. Currently, we are waiting for our panelists to join us. And while we are waiting for them, I'm going to briefly introduce myself and why I'm doing this. So I am Dr. Kiran Dintiala. I'm a physician, author, speaker. I was originally born in India, in Vijayawada, Andhra Pradesh. And from there, I have come to the United States for higher studies. I did my internal medicine residency. And then I did my master's in public health. And then I started practicing. And what I noticed over a period of time as I journeyed through my life as a physician, as a person, is that while the physical issues, the physical health issues like heart attack, hypertension, diabetes, cancer, and all these things are important and are being taken care of by our medical community. At the same time, the mental health issues, especially stress-related problems, they're often ignored. And because of that, all of us are suffering, both doctors and patients alike. And I have noticed again and again that when doctors are stressed or burnt out, it is not good for patients. Burnout is not good for physician well-being or patient well-being. These safety issues are a big concern. And for that reason, I am doing this seminar today in collaboration with Indian Medical Association. And shortly, we will be joined by IMA National President, Dr. Sharad Kumar Agarwal, IMA Honorary Secretary General, Dr. Anil Kumar Naik, IMA National Vice President, Dr. Sri Hari Rao Garu, who is instrumental in actually having this webinar get going and be able to have the collaboration with IMA. We will also be joined by Andhra Pradesh State President for IMA, Dr. Ravi Kishan Garu. And then last but not the least, Dr. Lakshmi Devi. She is a physician at Rainbow Hospital in Hyderabad. Not only that, she is a attorney, lawyer. So she can give us both medical perspective as well as legal perspective. So with that, let me just check where our panelists are so that I can invite them in, and then we can get started with our webinar. Hold on for 1 minute, please. Hello, Dr. Lakshmi Devi, can you hear me?
Yeah, I can hear you, Kiran.
Yeah, are you able to get in? Do you have any issues getting in with the video?
Yeah, it's actually showing that you can't start because the host has stopped it.
The host has to.
Yeah.
Okay, give me 1 second.
Yeah.
I just get on call with them for 1 second and see why there is this technical issue.
Dr. Kiran, you need to unmute yourself.
Hello, again, this is Dr. Kiran. Again, we are having some technical issues. So I think our team is trying to figure it out. Nothing better than actually a live meeting, people all getting together in a room. But, at the same time, I think we are very fortunate in this modern age that because of Zoom or other similar platforms that people all over the world can get together and talk and share their ideas. So while Dr. Lakshmi Devi is waiting for her video access, we do have her audio access. So I'm going to invite her to speak. Hello, Lakshmi Devi. How are you?
Yeah, I'm good. Thank you. How are you?
I'm doing very good. I consider it a privilege to share this platform with you because, as you know, she's the smartest doctor in our entire medical college class out of 150 people.
Exaggerating.
We used to get terrorized by her. We always used to study. We could never reach her excellence. So, and she continues her excellence now, not only as a doctor, but by choosing to become a lawyer. So that is pretty amazing. Lakshmi Devi, if you want to share anything, a couple of words before we get into the act.
Yeah, sure. So thank you so much, Kiran, but that was exaggeration. Yeah. So we all are like growing in our own careers, and because of the increasing litigation cases on doctors, uh, that actually provoked me to study about it. And knowledge is power anytime. So I felt that there's nothing wrong in simultaneously studying a course which is going to help us.
Yeah. No, there's
So
it. Very few people can do it. That's one thing.
no, reading was my passion since childhood, so I
Yeah,
keep it going.
yeah. That's good. That's good. Awesome. So let us get into the subject of calm doctors, safe patients, and why this is important. In my opinion, Dr. Lakshmi Devi, and over the past 15, 20 years that I have been a doctor, having seen a lot of patients, having seen my own people, means doctors, nurses, colleagues, the amount of stress that we all go through is tremendous. For patient side, that is a big issue. They are worried about what's going to happen to their health. They're anxious, they are fearful. And at the same time, especially at this juncture in this world where there is corporate medicine and rapid changes in healthcare, so much information, so much knowledge, new studies and all that, doctors are also very burnt out, stressed out for various reasons. And the point that I'm trying to say here is when doctors are stressed, burnt out, means they're worried, they can't sleep well at night, there is compassion, fatigue, and they feel like they're not being appreciated for all the good things that they're doing. It takes a toll on them. And when that happens, physicians, I have seen people, physicians who are depressed, who have committed suicides. So it's not good for them. At the same time, I have seen when doctors or nurses, when we are burnt out, that leads to patient safety issues like medication errors. For example, medication errors are the third leading cause of death in the United States. I don't know exactly the statistics in India. It is third leading cause of death, medication errors in the United States, right after cancer and heart disease. And you can see how bad it is, right? So that's the reason on this day of patient safety, International Patient Safety Day, according to World Health Organization, I thought it is equally important to add calmness, being present, being mindful as an important goal, both for the doctors and patients, so we can help each other. Doctors can help patients, and patient also, by not getting anxious or worried too much, they can help doctors help them. So that's the reason for this webinar. And I would definitely like to take your perspective on this idea.
So, Kiran, you're asking me to speak?
Yeah, I want to take your perspective on what I just said.
Okay. Yeah. So definitely the reasons for increase in the medical litigation was due to the increased consumer awareness and the forums available now. Okay, and the cost involved in the services. And then, as you said, the other thing was their anguish at that time.
Yep.
So all these things actually make a difference to the patients and their expectations.
Yeah.
Okay, and definitely the litigant attitude of the population has increased. Okay, so these are some of the factors where there are more number of medical legal cases now coming up. And as you said, yes, we have to strike a balance and try to remain calm in this scenario. And at the same time, how do we save ourselves? And at the same time, do good to the patient. So these are some things.
At one point of time, when I finished med school and came to America, right? You're like, everyone's talking about, oh, there is a medical legal risk. You got to be careful about this. You got to be careful about that. And while I was doing MBBS in India, I never heard the term in my entire 5.5 years of MBBS,
Correct.
Now, fast forward some 15 years later, it's a common thing, it seems to be, in India.
Yes.
Common thing. Like, I just visited India last month, and then I met a few doctors, and they were saying that, I thought when I went in, he's a neurosurgeon, there's another guy who's an ENT surgeon, and then of course, obviously, you guys are all there, with various specialties. And when I met people, I said, you're working in such a big, nice hospital, and you must be making a lot of money and you're having a nice time. And I'm like, no. We are having so much trouble here. And despite our best efforts, patients do not either appreciate or sometimes outright curse you. And sometimes it seems there are mob attacks. So there's a lot of stuff going on. Shed light on it, please.
Yeah. So one thing is the doctor need not panic whenever there's a mob attack or there is a violence scenario in the hospital. So the thing is, whenever there is negligence as such from the side of the doctor or the hospital, so the doctor can never be arrested. That is one thing.
Yeah.
So that is the immunity we have for our white collar jobs.
Yeah.
So that is one thing. And you can actually file an FIR in the nearby police station. Yeah. And then that there is a Medical Protection Act, Practitioners Protection Act, okay, which is operable in different states. Yeah. And there is imprisonment as well as fine, which is placed on the mob, whoever have destroyed that. And now we have CC cameras everywhere, which can collect evidence. Yeah. So that is sufficient to prove what has been done.
Yeah.
So simply you have to, I think, flee from the scene. That is the only thing there. Okay, when it is such a violent attack. Okay, so we should know that we do have protection against such acts. I mean, such violent
That,
reaction from the mobs. That is one thing.
yeah.
And this has actually come up after the COVID scenario where patients admitted in ICUs and then their status not known, and then sudden breaking of the news that they expired. So that led to violent reactions. So, after that, after that post-COVID thing, these we came to know that we do have these acts for our protection.
Actually, we discussed this, if you remember. I think
Yeah.
your panel member at one point of time during COVID,
Yes.
also,
Yes.
the
Yes.
Save
Yes.
Our Saviors program
Correct.
discussed partly the mob attacks and violence and all that was happening,
Correct.
which was.
Yes. Yes.
But I think you made a good point that the doctors or the medical practitioners who are watching
Yeah.
now, I think they are now definitely aware. They were not before. They are definitely aware now that they have legal protection and nothing to worry from a legal point of view. Just because something happened in the hospital doesn't mean it is entirely the doctor's fault, you know.
Correct. That's true.
But the
Mm-hmm.
point is also at the same time, even though you may not have done anything wrong, but
Yes.
they are very sensitive people, doctors, you know.
Yeah.
We take our duty. I'll talk most of the doctors, I would say, you know, yeah, there will be always some 5% people who don't care, but having been a doctor for a long time, I know most doctors mean well, they want to do the right thing for the patients.
Yeah.
And when something bad happens to the patient, you know,
Mm.
whether it is a real mistake or whether it's, you know, even when there is no mistake, when something bad happens, doctors really blame themselves a lot. There's a
Yeah.
lot of self-criticism that goes within, even before anyone points them out. It's a very difficult phase for them. Now, on top of it, going through any kind of legal trouble
Mm. Yeah.
can add excess stress and pressure to their life.
Yeah. Mm. Yeah. Yeah. Correct.
All the things. So while there is legal protection, there is no doubt about it, but
Mm.
there's a process, you know.
Yeah.
During
That's
that process, they go through a lot of suffering.
correct. So, at this juncture, I would like to mention two things. One is medical negligence and how to avoid it. Okay. And the other one is Consumer Protection Act. Okay. So, these two things are important for doctors. In cases where patients file cases saying that doctor was negligent, so that is where our documentation, our informed consent plays an important role.
Mhm.
Okay, so that's where doctors have to be careful about.
Mhm.
So, in explaining in the patient's own words,
Yeah.
the procedure which is going to happen, this is more of like surgical as well as medical work as well.
Mhm.
And the other thing is what are the alternative forms of therapy available
Yeah.
and what could be the probable side effects and the complications. So
Mhm.
when these things are properly explained, the
Yeah.
patient and the family are actually prepared well for these things.
Yeah.
So that's where the informed written consent plays a good role.
Yeah.
So nowadays we have video consent also. So that also forms a proper electronic evidence in the court of law.
Yeah.
That is one thing. And negligence as such cannot be proven on spot.
Hmm.
So that requires time to be proven. Okay, so and even the judge who is supposed to give a decision on a particular case has to depend on expert evidence from doctors.
Hmm.
Okay, because the judge is a non-medical person.
Got it.
Okay, so here they would check one point called reasonable action at that situation. Okay, the doctor need not be an expert in that, but should have reasonable expertise in that area and should have acted responsibly. So those two things are the ones which the judge would take into consideration. So apart from that, the documentary evidence and the case sheet and the whatever the consent and all these things will be added as evidence. So these are the things which we can prove against the negligence case when the patient or the family puts up a case in the court of law. So that is one thing.
Yeah.
And the other one is the Consumer Protection Act. So here, this was basically designed for goods and services, and medical service was included in this. And there was a lot of confusion, like how to decide medical service being inadequate. Okay, so and then this was basically to help the consumers because this was to support the patient actually.
Of course, yes.
Because because they would want some compensation or they want some action to be taken against the doctor or the hospital. Okay, so they want some remedy. So that was the reason why the medical service was also included in the Consumer Protection Act. Okay, but then there was a lot of controversy whether this has to be implemented in the Consumer Protection Act or not. That is the medical service. Because the inadequacy of care cannot be proven unless there is a clear-cut evidence of it. But as you said, every doctor always tries to do their best. Okay, so how can a patient prove that this was not adequate? Okay, so that's where was the confusion, whether to take it in this Consumer Protection Act, because this act actually is supposed to help the consumer to get a reply within 30 to 45 days of filing it. Okay, so this, and it is a very approachable area for the patient. That means there are some courts like district forums, state commission, and national commission.
Yeah.
And these are supposed to act like fast track courts, unlike the other courts where there is a lot of filing of cases and they do take a lot of time to give a decision.
That's good to know. So because they say justice delayed is justice denied.
Something like that.
Right.
So again, the judges who have to decide on who is right and who is wrong are also non-medical people. Okay, so they need to depend on, again, medical opinion, that is the peer reviews, and the normal clinical practice guidelines are very, very important in order to guide them.
I have a question here. Sorry to interrupt.
Yeah.
Think that we are in such a state now. We did med school. We had no discussion about it, right? Now, why are we here now in this kind of situation, thinking about all these legal aspects? And everyone listening, as soon as we are done with Dr. Lakshmi Devi's legal perspective, which is very, very important actually for all the people who are listening, we'll actually go deep down into how to be calm, you know, and why calm doctors are important. But let's take Dr. Lakshmi. Continue, please. Why are we in this position in the first place?
Yeah, actually speaking, as I said, the cost of medical services, and then the public awareness, okay, and then availability of forums to support these things, okay, and again, patient expectations and all these things have actually led to the rise in the number of litigant cases. That is one thing. And one thing I would like to reinforce here is any service which is done free of cost. Does not come under Consumer Protection Act.
Oh, so government is sued.
Yeah. So if you're doing anything free of cost, so
Yeah.
that cannot be challenged in the court of law.
Got it.
Yeah.
Yeah. I think we have Dr. Sharad Kumar Agarwal, sir, joined the panel. Sir, welcome.
Good morning.
Good morning. Good morning. Everyone who is here, Dr. Sharad Kumar Agarwal is the Indian Medical Association National President. And we are thrilled and honored to have you, sir, today, because I know how busy you are. And Dr. Sri Harirav told me that you have taken a lot of responsibility on your shoulders administratively, trying to help everyone, the doctors, and being an advocate for doctors and all. So we are very, very thrilled, sir. Thanks for joining us.
Yeah, I am at airport and waiting to catch the flight for Mumbai. So
Yeah.
my best wishes for this webinar.
Thank you, sir. Thank you, sir. Dr. Agarwal has accepted, our invitation as the chief guest for this webinar, sir. I know your time might be limited, and so we definitely want to use your time, whatever time that we have here, to take your perspective, your wisdom onto the current topics, what we are talking about. Very briefly, what I was mentioning before was that patient safety, of course, all of us, we recognize it as a very important thing, number one. My point is, as a physician over the past 15 years or so, having worked in India, having worked in the United States, what I noticed is the physician burnout, doctors being stressed out for various reasons, especially in this generation, definitely affects patient safety. When we say, okay, wash your hands, infection control, identify the patient's name, label and all those things, those are all important patient safety goals. There is no doubt about it. But what I notice is a lot of times when we are busy, we are stressed, we are distracted, we tend to make mistakes. As you know, I'm sure, in America, medical errors are the third leading cause of death, right after cancer and heart disease. It is not diabetes, it is not hypertension, it is not stroke, it is not COPD. Medical errors. I don't know the statistics in India. So what my whole point of doing this webinar is, there is need to increase the awareness for people that being more mindful, being calm is very important for improving patient safety. And we would like to take your perspective on it, your words of wisdom.
Thank you for inviting me here on a very auspicious day. Today is our beloved Prime Minister birthday. And today is the Vishwakarma Day also in India.
Yeah.
So all the people and the mechanics and everyone who uses the instrument, any kind of instrument, they celebrate this day. And of course, the International Patient Safety Day.
Yes.
Patient safety is the primemost subject and priority and the top priority for any doctor or hospital owner.
Yes.
Nowadays, as we know, that lot of thrust is on the patient safety because scientifically, based on the data and the studies, over the years and decade, probably the last decade, we understood the value of patient safety. If we deploy the different measures of counting and capturing the patient safety indicator and working on the improvement, it definitely improves the clinical outcome.
Yeah.
It reduces the LOS, average length of stay in the hospital.
Yeah.
It reduces the cost of the treatment.
Yeah.
It gives the hospital to opportunity to keep on changing the beds and the patient and give more and more, accommodate more and more needy patients who may be waiting for the sake of the beds, empty beds.
Sure.
And definitely the patient, the clinical satisfaction. If my patient is happy, so the doctor is the most satisfied person in the world.
100%.
Patients and family members are the satisfied, but doctor is the most satisfied person.
Totally.
Patient safety we can see in a two part.
Yeah.
One is a qualitative service safety, and second is the clinical safety.
Yeah.
Like in service safety part, what we deployed in our hospital, we deployed the administrator and the quality managers and make a team of under a manager where the engineer, the IT person, the nursing, everybody is the part of that team. And they used to have a safety round every month, twice or thrice, weekly or fortnightly. We organize a safety round where there is a specified checklist that they have to see whether there is an open wire, electric wire, or there is a wet floor. There is a the cleaning is happening, and whether we are putting the signages that floor is wet, whether the toilets having the anti-skid tiles,
Yeah.
whether the toilets and the beds are equipped with the nursing bell. At the same time, we see that whether the stretcher and the wheelchair, they are having the patient safety belt or not. So basically, we have to make sure safety in all respect. It is not only the clinical safety, but the mechanical and the quality safety also.
Yes.
We have to create safe environment for the patient. That patient, the point of patient safety is the why we are giving so much of stress on the patient safety, because we don't want to add anything in the suffering of the patient. Patient is coming to hospital for a treatment of some element.
Yes.
Then the bottom line is that we should not contribute in the pain of the patient by giving any additional injury in the form of if our floors are wet and we have not put in the signages, and God forbid some patient slept off and got an head injury or something like that. Or if patient is being transferred and there is no safety belt, and if he fall down.
Yes.
Likewise, in the in the toilets also.
Yeah.
We have to see that all the beds have the railing, proper railing with the lock. So these are the quality safety, service safety. In the clinical safety side, we have 4 or 5 indicators which we capture regularly by our team, and we monitor them month basis or weekly. Like catheter associated urinary tract infection, COTI,
Yeah.
central bloodline infection, central line infection, we say, surgical site infection,
Yes.
VAP, ventilatory associated pneumonia, bed sores, and we have the data available that what are the acceptable limit and range of these indicators. And
Yes.
we should be taking care that we should not be beyond that range, acceptable range worldwide.
Yes.
And if we are there, then we should put in force and imply the brain and our resources how to come down that. First, we have to do the root cause analysis, RCA, why these are not in the acceptable range, and then we should implement all these things. So definitely these all maneuver, these all things ultimately improve the patient satisfaction. Ultimately, it gives you the business. Ultimately, more and more patients come to the hospital, because many hospitals think, why should we waste so much of money to deploy all these systems? But no, it is a one-time investment, and you get the return of the investment continuously, day on day, month on month, year on year. And the best part is, if your patient is well satisfied, your hospital will be definitely be all time full with lot of good habita. So with these words, I understand that all the participants in this webinar, they will understand the value of patient safety as a moral value, being a doctor, and as a economical and numbers value also for those who running the hospital. With these words, again, congratulations to you for organizing the very important topic. inviting me here, and all the best to all the listener and the speaker and the organizer. Thank you very much. Long live IM.
Thank you, sir. Thank you, sir. I think those words of wisdom are very valuable. Those people who are listening, and I am part of committees here. Vascular, various infection-related committees here, and we actually get dinged, what we call, whenever there is a catheter-associated infection. For example, CAUTI. For example, I'm part of that committee. Our hospital, we get dinged. There is a certain percentage, and beyond that, if you have it. So that's all important. Sir, my next question to you would be, how are the burnout rates in doctors, the stress levels in doctors in India, in the people that you have seen, whether it is at a medical college, students level, postgraduates, or practicing doctors? What is your perspective?
See, I always take, I am not a believer of word stress. It is a negative word. I think stress is your capacity, your immunity towards any pressure, your resistant power against a pressure. If
Yeah.
you divide the pressure by your resistance power, it will come the stress.
Yeah.
So our training in our India, in our medical colleges, is like that. Like we always say, army training.
Yeah.
So the training of undergraduate level is so that we are trained like that, that we have to work 24, 48 hours.
Right.
And we are trained like that. This is a new, I think, norm nowadays, a fashion to coin this word stress. No, we are not burnout. We are not stressed. We are meant for. We have opted this profession by knowing, by choice, not by force. And when we are writing exam for competition, in India, for getting 1 lakh seat, 22 lakh aspirants are there writing exam. Out of 22 lakhs, you only 1 lakhs are getting the MBBS seat, the medical graduation seat. So it is by choice. And when by choice you are opting a profession, which is the noblest and most pious profession in the earth, on the earth, I don't think any profession is as pious, as noble, as respectable as the medical profession. So there is no point of stress. There is no point of burnout. You have to decide how much work you want to do. So I personally don't agree with this word of stress and burnout, because as we are last 25 years we are working. We worked in the COVID probably 48 hours or more than 72 hours continuously.
Yeah.
See, there is a tiredness. Yes, of course, tiredness is always there. If you don't have a proper sleep, if you don't have a proper food, there is a element of tiredness. But tiredness cannot be synonymous with the stress or burnout. So probably people are using much harder and harsh term for the tiredness, which was there in 25 year back also. And people are coining burnout and stress term for simple tiredness. So I don't think there is any burnout or stress in medical field, because we opted this. It is not a 8-hour job. It is not just a official job that you are coming, signing few paper and going back to home, or working from home on computer. In a clinician, as a clinician, you are bound to be with the patient, and limit you can set yourself. Yes, of course, in the medical college and the hospital, in younger age, when you have more capacity to bear the pressure, you have been forced to 48 hours, sometimes for 72-hour duties. But it is since ancient time, since decade, it is happening like this. It is not a new thing. Now situation has improved. The working atmosphere has improved. There is a doctor's duty room out there. 25 year, 30 year back, there are hardly any doctor duty room. So things are improving a lot in India. And personally, I don't agree with the word of the stress. And even I advise those who use that burnout and stress, they should just take it easy. Yes, it is a tiredness. And after taking a proper relaxation, wherever you want to chill out, after that having chill out, you are again fresh.
Sir, obviously, you became the president of IMA because you were able to tackle stress very well, tackle all the pressures very well. So you are a very strong personality. It seems to be, your mindset seems to be very strong. So obviously you were able to, that's the reason, lead the IMA and get to that stage, which I really appreciate the mindset with which you are approaching it, because the moment you say, oh, that stress is there or that is there, the more you start feeling negative, bad. So from that point of view, I do agree with you that don't tell yourself constantly that you are stressed, because the more you tell yourself that you are stressed, the more stress you are going to feel automatically.
Absolutely. Absolutely. We feel pride. See, as a doctor, we feel pride to serve the patient. We feel pride. Whenever there is a serious patient on the ventilator, you see, is there any doctor who say, I am tired, I am not going to take the ABG? No, no doctor. Neither doctor nor the healthcare worker.
Okay. So, sir, at the same time, I'm sure, there are different mentalities, right? There are different personalities. Some people can take that pressure and be able to perform well. Like, for example, you. And there are some people who never got any kind of training, or, they don't have that mindset, for example, and yet knowingly or unknowingly they become doctors or choose a profession that is high pressure, right? Now, what should we do with those people is the question, because some people automatically, they have the capability. I know, because no one taught most of the doctors, we just do it. But also we are seeing, for example, suicides, depression in doctors. For example, I'll share 2 points, from articles. One is in United States, we lose approximately 300 to 400 doctors each year because of depression and suicide. 300 to 400 doctors. And that is approximately 1 or 2 medical classes, and that too after spending years of time, experience, and all that. The second thing is, for the past 2-3 years, there's a lot of talk about it here in America. I think in India, it is still probably maybe not talked too much. I know some people are talking. For example, in 2022, Medscape did a survey and said like almost 48% of doctors are burnt out, means not able to sleep, exhausted, getting depressed, feeling isolated, hopeless. So my question for you would be, because the numbers are there, despite we wanting good doctors and wanting to help people and all that. So what could have led to these people? Because we'll focus on those people who are not able to handle whatever that they're supposed to, and how we can help them. So what do you think could have contributed to these people's situation?
Number one, definitely, it's an important point. But I usually don't go by the data which has been not vetted, because we don't know the survey, what are the denominator, what is the group they exercise, whether they went to the young doctor posted in the emergency ICU in a medical college, so whether they have went to the clinicians who are 20-year practicing. So I am not going by data. Yes, the point you raised is a very important point.
Yeah.
I think number one, as I said, that we are confusing, the young generation is confusing with the term from tiredness to the stress. Number one. Number two, lot of ambitions are there now.
Yeah.
Everybody want to reach the top in a 2 or 3 year after coming out of the PG graduation.
Yeah.
And that they are putting lot of pressure on themselves to reach that milestone which the others have reached over decades. They
Yeah.
want to cover that distance in a year 2. That additional pressure is putting them under depression when they are not able to handle that pressure. Number 3, I think that 99%, but rather more than 99%, who are in the critical care or in emergency service or into 24 into 7 kind of services, their training is like that. They hardly have any problem unless until there are some personality problems also. Okay,
Yeah.
so there is a type A, type B, type C kind of personality.
Right.
So if it is contributed through that personality, so even if you are in any profession, so you cannot blame the profession for their tendency to suicide. Number 3 is probably nowadays, as in India, a lot of social media and WhatsApp group and so much of in social media. So even if they are the younger generation or even the any generation, if they have no work, they keep on busy on the social media, and there is a decrease in sleep. So they are not able to take a proper sleep, and that added up to the pressure and tiredness of the patients.
Yeah.
If you don't have a proper sleep, then ultimately it adds up the pressure.
Yes.
So I think more than medical cause, these are the different cause which is adding the pressure on the doctors, not the because of the patient. And for a personality cause, if you have a tendency as a personality defect, that can happen anywhere. It is in all the profession. So it should not be seen as the health hazard, as the occupational hazard, but it is a type of personality, and definitely those people should be taken care. Should be the others people should be vigilant and find out those kind of people and keep talking to them. They should not be remain in a silos or in a alone kind of system. They should be taken care by the system, and we should talk to them. We should do counseling of those doctors or those personality, because suicide is very unfortunate,
Yeah.
very unfortunate for the family also. Those that are doing that, I am sorry for them also, and for their family members also. This is a loss, this is a nation loss. After becoming a doctor, if somebody is doing suicide, it is a loss to family, but bigger than it is a nation loss.
Yeah.
So I'm very sorry, and definitely uh, it needs to be looked after, but lot of fine tuning is required in your daily routine also. Daily pursuit has to be changed. We should not be giving much time to the social media uh, at the cost of proper sleep.
100%, sir. Very well said. Every single point what you said. I'm very happy that you are seeing both sides of the coin. Means on one side, there are strong people who can, manage and everything because their personality or the way that they manage their life, they can take care of things very well. On the other side, I'm very glad that you touched on the, social media aspects and, some people not able to manage whatever that they're trying to do. I think that is equally important and need to help them. And, my whole goal is to help the people on the other side. You see what I'm saying? Who, for whatever reason, they did not learn the skills growing up, nor they had that pressure taking capacity for whatever reason. No need to blame anyone. That is how I see it. I don't blame anyone. And what kind of support can be provided for these people? Like, the one example that I often give is when we have someone to go and swim in the ocean, for example. First, we put them in a swimming pool, teach them, and then
Absolutely.
all that. And then after all the training, we then throw them into the ocean and try.
That is what I mean by the training. The training itself is a design like that.
Yeah.
So there is no fault in the training system. It is the personality, and it is unfortunate. But I must say it is unfortunate.
Yeah.
And whatever we can help them, we can do, we should do.
Absolutely. Absolutely. Bharat Kumar Agarwal has definitely gave us some very good points about patient safety as well as burnout. Here are some points that I want to share definitely without any doubt in my research, what I have done and what I have discovered. Let me very briefly share with everyone who is watching this one. And maybe after this, we'll be happy to take some questions also from the audience. Okay. I'm just going to share my screen for 1 second. I need a screen sharing capability. Can the host enable that for me, please? One second. All right, I got my screen sharing capability. So let's start with this very brief presentation to make some main points. Come doctors, save patients, healthcare burnout solutions. And my request for all the doctors is that every day you save so many lives. Do not forget to save your own. You're busy, I know. You're working hard, but make sure you take time to exercise, to relax, to spend time with your family. Eat well. Take care of yourself very well. Very, very important. And here are some slides that shows the research of job stress and patient safety culture, whether it is nurses or doctors. There are studies that were done that show that when there is too much stress in doctors' lives, clinicians' lives, nurses' lives, it definitely leads to poor outcomes for patients. Patient safety is jeopardized. And even the World Health Organization has defined burnout as an occupational phenomenon, not a medical condition. In ICD-11, that is a very big thing. It's not a medical condition. It's the occupational phenomenon or a hazard. And we need to be aware of this point. And awareness is the first step towards solving any problem. For example, if you have a nail stuck in your foot as you're walking, the pain is there so that you can stop and immediately remove the nail from your foot. But let us say if you have diabetes and then you have numbness because of peripheral neuropathy and you have numbness in your feet, you walk on the nail, you don't feel it, what happens? There is no pain and slowly you're going to get infection, probably gangrene, and then foot has to be taken off completely. So awareness is the first step towards improving anything. And pain is not necessarily always a bad thing, as we know. The same way, when it comes to the stress and burnout and various problems that we are facing, we need to be aware of it. Let's talk about it. Let's see why we are in this state as a person, as a medical community, as a society in general. 20 years ago, none of us discussed about it. Even 10 years ago, very few people discussed about it. Right now, everyone is discussing about it. American Medical Association is taking major steps to help physician burnout. Stanford is doing a lot of research and coming with programs for physician well-being. And all these are great things, what they are doing. Here are the statistics. It doesn't matter which journal you go to. You can go to NEJM, you can go to JAMA, Journal of American Medical Association, or something else. The physician burnout statistics are alarming. And approximately $6.3 billion per annum are lost because of physician burnout. Very important, very important. Physician suicide rates lead to 1 million lost patients. I can keep on going with the statistics for the next hour, but that is not my intention. Let's get to the solution very quickly. And right before that, we live in a dysfunctional healthcare system. Everyone who works in a healthcare system, who is a doctor, who is a nurse, knows we live in a dysfunctional healthcare system, demanding patients. Of course, they may have their own problems, but when we are in the midst of it, we feel like, oh my God, it's too much. Conflict with people around you, with staff, with the nurses, with other doctors, with administrators, too many government regulations, insurance issues in America. In India, probably insurance issues are not too big right now. And we have our own personal life issues too. You may be going through a financial challenge. You may be going through a personal challenge. And sometimes you feel like you're attacked by people psychologically. You know, all these things put tremendous amount of pressure on doctors without any doubt. And this is the everyday stress cycle that we go through. Constant interruptions to, you know, people asking this, asking that, and then you have to focus on something. Angry attendants, crashing patients, delayed care, stuck in meetings. A doctor's life is not easy. And the Medscape survey, 130,000 physicians from 29 specialties. That's a lot of physicians. A lot of physicians. And it's the latest survey in 2022. Every single one is burnt out. Look, emergency medicine, 60%, critical care, 56%, OBGYN, 53%, infection is at 51%, almost everyone, except, you know, maybe dermatology, pathology, and a few other people, it's less. But see, most of them, at least half of them, are burnt out, most specialties. Outpatient, inpatient, it doesn't matter. Look at the statistics. It doesn't matter. And then we all know that stress leads to heart attacks. But this is an article from Harvard in Lancet Journal. 4 or 5 years ago, it was published, where whenever you are stressed, the amygdala gets activated, the emotional center, and when they correlated that using PET scans and MRI of the brain, and then they checked for atherosclerosis, they noticed that there is a significant increase in cardiovascular risk. Not only that, we all know chronic stress is related to many diseases. In fact, chronic stress leads to chronic inflammation. And now we know for sure by research that almost 70 to 80% of chronic diseases are because of chronic inflammation. And stress is the underlying cause for that. The more you look at it, the more clear it is. You know, so there's so many things, you know, if I just keep going, there are so many things. The burnout thing, the stress thing is real. It's happening. We can't ignore it. And from a patient safety perspective, what I see is, for patient safety, the doctor, the nurse, they have to be present in their minds. Because if you're distracted, if you're tired, sleepless, then you're going to make a mistake. You're seeing on the computer screen or maybe in the paper chart, oh, CT scan, 4 millimeters nodule, but you don't notice it. You don't notice it because you're so tired or you're so stressed or you're so restless for whatever reason. And then 6 months or 1 year later, maybe that nodule turns into cancer. You're seeing on the computer screen potassium is 2.9, but you're so busy looking at everything. You miss that. And then it goes down further. The patient is having diarrhea, for example. And then you end up with a cardiac arrhythmia. I have seen these things very practically in my practice, in the hospitals where I worked, and it definitely affects patient safety. It leads to medical errors. Also, when people are stressed, distracted, they are not good listeners. They don't listen. They don't try to understand. Ah, okay, all right. And so they miss important information, and the patients may not feel understood. That is a breakdown of trust. That is a breakdown of communication that happens. So all these things are real. And what I propose is, when we keep our minds calm, then our focus improves, our concentration improves. Even when there are distractions, you can perform well. Even when there is pressure, you can take it. You can multitask. A restless mind cannot multitask. A calm mind can multitask. Someone calling you, you take this phone call and then come back to what you're doing. And then someone pages you, you take the pager, answer that, you come back here. And while even you're talking there, there is a crashing patient and you have to talk to the nurse, give instructions to come back here. You could multitask and perform very well when your mind is calm. So my point is, by adding calmness to your life, you can improve your own life as well as patients' lives. So I'll hold off here for 1 second to see if Dr. Lakshmi Devi has any comments. And then also, I think right after this, we should take some questions from people, and I'll be happy to answer. Dr. Lakshmi Devi, do you have any comments, questions, points to mention?
Yeah, very well said, Kiran. So, and the data is really alarming to know that like almost every brand, starting from clinical to non-clinical, there is a good percentage from 30 to 60. And as you said, a calm mind would definitely give a better outcome. And that's more important for doctors. And you have reinforced that part. Like, I think if you would suggest a few techniques of how to do this, maybe in between, in the midst of things.
Yeah.
Sometimes, yeah, we do go through many things and many demanding patients, triage, I mean, like, but in the midst of those things, how do we maintain this at the back end? That's something which would help our viewers as well.
Absolutely. So I'll give an analogy first, and then we'll jump into the solution part, okay? And even before the analogy, I have a question too. For every single person who is watching this, did you brush your teeth this morning? I'll bother Dr. Lakshmi Devi because she's can answer. She has the mic, but I'm asking everyone here. Did you this morning?
Yes.
Yesterday?
Yes.
Day before?
Yes.
Your entire life, every single day?
Yes. Yes.
So what happens if you don't for like 3 or 4 days?
Of course, it would turn out to be really uncomfortable for myself as well as others. It's something which is very basic.
Right? Very basic. You don't even have to wait for 3 days, just 1 day. And
Yes.
you won't be able to tolerate the foul smell, right?
Yes.
Now, you spend every day brushing your teeth so that you can take away the plaque, so that you can prevent the accumulation of the plaque on your teeth, so that they are healthy. You take a bath or shower every day, maybe another 5-10 minutes you spend on it. You eat breakfast, lunch, dinner. And for the whole process, just to maintain this body as it is, I'm not talking about going for 1 hour gym or jogging and all those things, just to maintain this body so that it can live. We are spending almost 1.5 to 2 hours. Now, my next question for everyone watching is, do you brush your mind every day? Do you empty your mind of negativity every day? Because as you go through the day, as things happen in life, negativity accumulates, negative emotions, negative thoughts, right? That is what is stress. That's the reason our minds are foul smelling, means stressed, because we never take time to brush it off. And all your life, you're accumulating the emotional traumas, what your wife said, what your husband said, what your mom said when you are 15-year-old. Some people remember all those things even now. All those things leave impressions, negativity in our mind. And if we can empty our mind of negativity every day, like we brush our teeth, just take 10-15 minutes, maybe at the end of the day, empty your mind. Automatically, that routine will take 80 to 90% of stress away from your life. Very simple. Very simple. And there are some basic principles that everyone needs to understand what stress is, how our mind works. And once you understand, then whatever the incoming insults, coming from people, from your environment, the stressors and all that, you'll be able to shield yourself. You'll be almost like in a bulletproof car, cushioned and impenetrable to the nails of stressors, to the bullets of stressors. They can't really penetrate you easily. So when a patient says something, a family member says something, or whatever it is happening in your life, maybe it could be a real thing, but your ability to journey through that real challenge becomes so much better that you can manage the challenges better. The challenges will always be there, but your strength, your ability, that greatly increases. Now, how can we do this in a simple way? That's the question, really, isn't it? None of us have time. If I ask you to meditate for an hour a day, you're like, oh, okay, sorry, bye. I don't have time for that. So keeping that in perspective, I have designed a 3-step system. It's called the PET system. P stands for 3 principles, E stands for 2 relaxation exercises, and T stands for 1 calming technique. When anyone practices it regularly, automatically their stress levels go down and they find more peace and joy in their lives. Now, I will start with the P component, the principles, so that everyone who is watching this webinar, they can go home with something very practically implementable in their life every day. So the 3 principles is a very big topic, but I'm going to condense into 3 simple laws, 3 simple points that you can remember. I call them the laws of thought mechanics. Like our physical world is governed by Newton's laws, the same way our mental world is governed by certain laws too. The first law of thought mechanics is that as long as thoughts are flowing freely in your mind, you're naturally peaceful and joyful. The second law is stagnated thoughts lead to stress. And the third law is whatever thoughts that you focus upon, that becomes your reality. Let me give you an example. Imagine water flowing in the river. As long as the water is flowing freely, you can just take some water and you can drink it. It's very healthy, typically. But the moment there is stagnation of water, all the bacteria, dirt, everything accumulates. Mosquitoes, foul smelling. Your mind is like a river. As long as you let thoughts flow freely, whatever that's happening, you'll be naturally peaceful. The moment you hold on to one thought, whatever it is, oh, this guy said that, my husband said this, my wife said this, or they did this, or this happened to me. And yeah, they said that and that happened to you, but if you hold on to it, you are going to create a dam where it is just going to build a nest of negativity in your head. And that is what makes you feel miserable and unhappy. The moment you let it go, the moment you say, it's okay, let go, just let go. The moment you say that and be able to do that, positive thoughts are going to come forth and flow and wash all the negativity away. But the question is, how do you do it? You know, letting go, saying it is easy. Doing it is not necessarily so easy. Because thoughts can be very tenacious. They hold on to you, or you hold on to them very strongly. There is a relaxation exercise which I will share. It's going to be helpful. But before the relaxation exercise, we have this third law of thought mechanics, which is also going to help you, which is the third law. Whatever thoughts you focus upon, that becomes your reality. Imagine a TV and you're watching a movie. If it is a horror movie, of course, obviously you're going to feel horrible. If you're a feel-good movie, happy comedy movie, of course you're going to laugh out loud. The same way in your mind, you're running movie scenes in your mind, depending on what thoughts you're focusing on each moment. And the remote is in your hand. Like you change the TV channel, you can, the moment you become aware of it, you can actually change the channel in your mind. Okay, I'm not going to focus on all the horrible things that my wife said or my boss said, whatever that happened, or the patient said in this case, or my colleague said. I'm going to focus on something else. I know that's done, it's past, it's over. I'm not going to focus on it. Yeah, whatever it is. I'm going to focus on something different. So you have that capability. Okay. But this is in brief, like a very vast subject, distilled into 3 simple points. Okay. So those are the laws of thought mechanics. The second thing is a relaxation exercise. When you practice relaxation exercise, especially using your breathing, what I have done is I have simplified this exercise so much that it doesn't matter your race, religion, creed, caste, it doesn't matter where you are, what you are doing, which profession. If you practice it, even like 5 to 10 minutes, it's going to create the profound, deep relaxation, calmness within you. And you'll be able to let go of the negativity. You know, especially this is good before going to sleep. So you're empty your mind of all the negativity. And it is also good when you wake up in the morning, if you can do it. It is also good in between, like you have 5 minutes during lunch break. Let's say you have 30 minutes for lunch, 20-25 minutes eat, 5 minutes practice this. Just 5 minutes. And the more you do it regularly, the easier it becomes in your life. That relaxation exercise that answers your question, what you can do, right? But also, as you know, as a gold medalist, as well as a lawyer, as a doctor, and as an intellectual, nothing substantial can be learned by just spending 5 minutes, 10 minutes here. People do need to invest their time and energy slowly and steadily. You don't have to spend 2 hours a day. But even if you spend the 20 to 30 minutes each day, slowly and steadily, or maybe weekends, you take a little bit more time and you gain these skills, you'll come to a maintenance phase where you already know, like you became a doctor because you studied so hard. Now you don't need to really study that hard to be a doctor. Yeah, once in a while you may need to look through the books and journals to refresh your knowledge, but you're practicing, right? The same way, maybe in the initial phases, people who are stressed, anxious, worried, fearful, depressed, hopeless, they may need to go through a more, vigorous learning. But once they get it, it's like, yeah, 15 to 20 minutes a day, I'm pretty good, So that is how the relaxation exercises. And there is a calming technique also. When you practice 20 minutes a day, it is going to instill a deep calmness. And I'm going to share these things with you guys, everyone who registered, as a bonus. Okay, I'm going to share it with you. I will send it to you so that you can learn these things. But let us welcome our beloved Dr. Sri Hari Rao Garu. He's the National Vice President of Indian Medical Association. And sir, I think you can you unmute yourself? He's trying to unmute himself.
Okay, sir, I'm audible.
Yeah.
Good morning, everybody.
Sir, good morning. Thanks so much for joining us.
Hello.
Thanks so much for joining us. Dr. Sri Hari Rao Garu is a National Vice President for Indian Medical Association, and also he's a radiologist by profession, and he's located in Tirupati. And he's the main person, because of him only we are able to do this seminar. He helped organize this and helped us a lot. Spread the word to people. So thank you, sir. Thanks for joining.
Thank you, Kiran. Thank you for this great opportunity, along with my national president and secretary general and other of my members and other dignitaries and delegates. Thank you. It's an excellent program. I am receiving so many messages, even though I am not Jain. I am receiving lots of messages. It is excellent program is going on. Already our national president has joined and given his address, I think.
Yeah. He made very strong points, sir. We discussed a lot of things, because today, International Patient Safety Day, definitely like to hear your perspective on patient safety, and how we can improve it, and also a few words about physician burnout, what you have seen. I know you have your daughter going through medical college right now, I believe.
Yes. Yes.
Right.
Actually, this day, this is started on 2019. This our International or World Patient Safety Day. This is for the sake of to raise awareness to reduce the patient harm and improve the functioning of the patient safety. That is the main motto.
Yeah.
And for that, you have to involve the stakeholders like patients, families, and policy makers, healthcare workers, and healthcare leaders, and some of the organizations to work together and to safeguard the patient safety. And this year already our WHO given slogan as elevate the voice of patient. And also the theme of this year is the engaging patients for patient safety. As I told you now, 2019 is the day started established in 2019 by
Yeah.
WHO. From that onwards, we are celebrating or organizing this day in every year, September 17th. And 2019, they have given the theme that is the patient safety, a global health priority. In 2020, speak up for health workers' safety. And 2021, safe maternal and neonate. And 22, medication safety. So the main thought is the patient safety is the main motto and the aim of the WHO. For that, the key action or key objectives for that is to raise awareness among the public and the patient regarding the healthcare and the policy. And another, they engage everyone in society to adopt safe healthcare and practices and empowering patients and families towards the improvement of healthcare and advocate the urgent need to align the patient and with the Global Action Safety Plan 2021-30. This is the key action areas and objectives for this patient safety. And I'm the that the patient actual safety goals are to ensuring that patients are accurately diagnosed and treated first. It prevents the medications and problems and effective communication not only to patients but also to the healthcare workers. Mainly, hello.
Yes, sir. Yes, sir. Listening, actually. Yeah, communication is a very important point, like what you mentioned.
Yes. 1 second. And ensuring the patients are accurately diagnosed and treated for this. It prevents the medical problem and effective communication, not only to the patients and their families, because mainly our ethical workers, like to doctors and nurses, paramedical staff, to avoid the miscommunication.
Yeah.
And also, before administering the drug, take safety measures to prevent side effects.
Hello? Hello?
And finally, I have to confirm the exact site and side of the body part. So we can do the needful for the patient. Take care about the hospital acquired infections. Further, the implement infection control measures, and also take care about the hydrogen mistakes done by our healthcare workers. Minimize the risk of falls that is higher to lower in healthcare settings, mainly chronic and vulnerable diseases. So these are the main motto on our side. Doctor said you have to take care about the patient regarding the patient safety.
Yeah. Hello? Hello?
And the situation worsened with the COVID-19 pandemic, and due to multiple lockdowns caused by the pandemic, and led to increase in stress and anxiety, a man individual as well as doctors also. So
Yeah.
this often leads to chronic exposure to stress among doctors, resulting the burnout. Most of the surveys suggest the 40 to 50% of doctors and nurses are.
Yeah. Most of the doctors are burnt out. Yeah, you're mentioning that 40 to 50%. So I think your audio and video are stuck. Yeah.
Marshall and Jackson burnout is three-dimensional construct consisting of emotional exhaustion, depersonalization, and reduced personal accomplishment. If
Yeah.
doctors, nurses, and patients are totally calm, they are not anxious or exclusively worried, communication is clear, medical errors are minimized. For that, the role of the patients and the
I think Dr. Srihar Rao Garu is having some trouble.
accountable for patient safety.
Yeah.
So everyone involved in the healthcare, be it doctor, nurse, patient, or family members, plays a critical role in the safety of the patient. So you have to involve the patient and healthcare workers and all the family members to prevent this most the unaffected things for the patient. So this day you are attending, organizing. He has done a lot of programs in COVID pandemic time. At that time, we are organized one meeting along with our national president. At that time, Dr. Jailal sir is the president, and also involved the American Medical Association president also.
Yes.
So he is regularly conducting this type of webinars and programs to enlighten and aware the patients and also it is useful for our doctors also.
Yes. Absolutely, sir. Very well said. Very well said.
Prevent that one, you have to maintain calmness and attention is required for towards the patient. If you are not attend towards the patient will not satisfy our treatment or our any procedure. So we have to concentrate the patient, take care about the patient, then we can give more patient safety than the in anxious or stress period. So you have to maintain calmness and maintain the whatever you have to towards the patient, you have to do the needful with the calm mind or without anxiety or stress or strain.
Yes.
Proceed, Kiran.
Yes, sir. 100%. 100%.
This is my
100% agreed with everything that you said. And one key thing that I want to definitely emphasize here is the communication aspect. A lot of times, breakdown of communication is a source of many 80 to 90% of problems are because of breakdown of.
Kiran.
Yes, sir.
Not audible.
Not audible. Not audible. Hello, Lakshmi Devi, can you hear me?
You're audible. You're audible.
I'm audible. Okay. So a lot of times the breakdown of communication is a major issue between patient and doctors, between doctors and doctors, between nurses and nurses. Breakdown of communication is a major. And again, if you track it down very clearly, if someone is stressed out, restless, distressed, they don't have time to listen. Their communication, how they are expressing to others, may not be good. And even if they're telling you, it may not be in a compassionate way. You know, it may not be in a compassionate way. So, again, as Dr. Srihar Rao Garu said, a calm mind will promote good communication. So, sir, any other points, sir? Please continue. Please, I'm just emphasizing the point about communication, about what you said. Any other point that you want to mention, sir? Can you hear me?
I'm not audible.
You can't hear me? You can't hear me. Okay. Got it. So here it seems we have some questions from.
They get patients also actually they are responsible having towards the hospital. The patient responsible as a hospital patient, they have to give the, as you have told, the information, communication, for the sake of communication, they have to give all the related information about his health and including present condition, past illness, and hospitalization, medications, and natural products using there. What is taking the treatment, and from a completely provides accurate information, including full name, address, and other information. When they have the right to ask, whenever they understand the given treatment or any diagnosis regarding the patient is not understanding, you can ask directly to the doctor and abide the hospital rules. Patient has to abide the hospital rules and also they treat hospital staff and the other patient visitors with courtesy and respect. If they have taken an appointment, they have to be on time. If they want to cancel or reschedule the appointment, they have to inform them in advance in case of cancellation or reschedule. Not give the medical prescriptions to the others, whatever the prescribed by doctors to their patient. Follow the prescribed treatment plan and careful comply with the instructions given. To accept where applicable and adaptation of the environment to ensure safe and secure stay in hospitals. So patients have to respect the hospital management, and also they have the right to get the refuse. They have to refuse the treatment. They have to get the information, whatever the information they want to from the hospital. They will get it and express and if they want a special any preference for towards the treatment or any spiritual or cultural needs, right to get protection and physical abuse and the neglected in hospitals and they give informed consent also and complaint and dismissal. They have the right to give any complaint, any problem happened in the hospital and their addressal. This one is there. If you have any problem with the courts also, you can there is a addressal services available for further higher up courts also. They will know the expected cost of the treatment also from the doctors. They will know the expected cost and they have right to have the second opinion and all. So patients have so many rights, and as well as to maintain, as I am told before, they have to be responsibilities also towards the hospitals and doctors also.
That's part of patient safety, knowing their rights,
Yes,
knowing
yes,
responsibilities, so that
yes. Both,
it is safe for them.
yes. And family members also, if they seek any clarifications and asking questions and pointing out the concern, these initiatives could be decrease the errors and improve the quality of the healthcare. If they have any doubts or they want any clarifications, you can ask doctors and clarify. Then the communication will be clear and there is no misunderstanding between the patient and the healthcare providers. So it will do the betterment of the patient. So the patient safety is main for the doctors and also as you told, before I joined, I listened about how to doctors will take care about this stress and all. So we have to protect our profession, healthcare providers and healthcare. This one system has to secured by this stress and stress. So many more techniques to how to get out of this stress and strain, so that it will be beneficial to our members and doctors to day-to-day practice. So, if any, we will continue this series. This needs for our profession. They have to learn the things about out of this. What are the types of modalities to test out this stress and all. So I need your support and cooperation for further programs also. We will continue these programs as we'll discuss the series of programs. This will definitely beneficial to our profession.
Sure, sir. My
Thank
pleasure.
you, Kiran.
Your help, definitely.
Thank you.
Thank you. Thanks for sharing your knowledge. There is one more question here. Dr. Purna Chandrika has raised her hand. So I'm going to, enable your, enable you to talk. So let's see.
Yeah.
Where is she? Yeah, talking permitted. So Dr. Purna Chandrika, you may ask your question.
Hello, sir. Good morning.
Hello, hi.
Hello.
Good morning.
Hello, am I audible, sir?
You're audible, yes.
Hello.
Yeah.
Yeah, sometimes in spite of all efforts in the ICU cases and all, after complete care of the patient and all, it's in government sector sometimes ventilatory failures like that happen suddenly. That time, even we are engaged in some other cases and we don't have alternate equipment. In that situation, in changing hours and all, even sisters and ward boys will also won't work properly. And that times after completing our duty, if we came to know that patient died, when we are planned to extubate after within 1 hour, we feel guilt. But that time we feel very stressful, though we are alone. Then how to maintain the situations? Am I clear, sir?
Yeah, I think let me repeat the question so that I understand.
Actually, in some ICU setups and all, in government setup, I am working right now.
Yes.
We had followed, we can't follow up the every day. If we are only on duty, we can see sometimes.
Yeah.
Sometimes if we are interested enough to see the case, we will follow up, though we are in some busy schedule in some other cases.
Yeah.
The patient is good, and when we are planning to extubate after 1 hour like that, in changing hours like 8 a.m. like that, after 11 p.m. like that, if the patient died, just due to the ventilator failure and unattendance, how due to lack of another ventilator like that, if the mob is coming and doing some nonsense, how to handle that situation?
Yes, yes. First of all, there are two questions that I am seeing. One is how to handle the guilt. Number two is how to handle the. I think these are the things, because let's talk about the guilt first. You have done everything. You have done everything that is for the patient, and sometimes our resources do not permit us, unfortunately, especially in the Indian setting, where you do not have enough. You do not have enough staff. You don't have the medication. Sometimes you don't have proper diagnostics, and you are doing the best that you can at that moment. And yes, it is terrible for a patient to die. We never feel happy when a patient dies. We always feel very, 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 very bad. Definitely. But also it is important to shield ourselves out of that guilt. I think it is important to tell yourself that I did everything that's possible. I'm sorry. And for that hardworking, conscientious doctor inside, that's the reason I believe that we need to be very conscientious and do the hard work and all that is needed, so that when incidents like this happen, we don't self-criticize ourselves. Even when we do all the things, we will still self-criticize ourselves. I know how exactly it feels and what you are saying. There is only one way, Dr. Purnachandrika, as far as I know, that is to be able to console ourselves. I have done everything in my capacity with the resources that were given to me, and this is what all I can do. I think you need to tell yourself, we need to tell ourselves when situations like that arise so many times, so that we feel okay. And having also support system, other doctors or maybe friends who could understand the situation and be supportive, can be very helpful during those situations. I think number one. Number two, coming to the mob issues, I live in America. We don't see that too much like that here, but I have heard from my friends about the mob attacks and all that. Like Dr. Lakshmi Devi mentioned earlier, we do have legal protection from mobs and all that. So we should be able to file a case or get the police, or if there is a security at all, at the hospital. But sometimes there may be so many people, the security might not be able to do too much. So I do definitely see that is a concern. Again, this comes back to lack of resources, in my opinion. The system has to improve for our lives to get better and for patients' lives to get better. I think more funding should come to healthcare and more resources should be allotted, and the system has to be improved. We need to learn from maybe Western systems also sometimes and see what they are doing and implement it. This is my perspective, but I would also let Dr. Sri Harirao Garu or Dr. Lakshmi Devi to shed light on this topic.
First, our doctors are united, sir. United, and whenever the problems comes, they have to come through that. Wherever the problem like happen. So, if so many doctors are come to the place and whatever they happen, the thing is that ICU or any place. Generally, in our private practice, we have formed a committees like that in the rescue saving committees. Whenever the problems come, that committee will come first because the patient will know some of the doctors. They come from different places. They know some of the doctors. They will listen our doctor's words whenever the problem. If the doctor says, and sometimes we are asking the patient attendants to get some one doctor those from their family. Then only they will know the things happen. So you can explain easily to the patient attendants. Otherwise, patient will not know our terminology and our technology, whatever, what is the treatment given, what has happened. So you can explain the things to better to if any family member is doctor or any friends or having the patients having the friends are doctors. So we can explain clearly. Otherwise, the problem will be enhanced by the patients or mob will create a nuisance in the hospital. If
Coming
death is happened, you ask for the post-mortem first. You ask patients post-mortem and complaint, whatever the complaint they have will give police complaint or state medical council is there to let to know the problems and they will be punishment if they need doing any wrong.
Coming back to sir, the same communication and building trust.
Yeah,
Communication and building trust, I think,
communication.
is the key.
Yes, yes.
Keeps coming
Yeah.
back. And again, we can't communicate unless we are calm. Honestly, that is my strong point on this one. People need to be calm,
Yes, yes.
so that they can communicate well, they can think well, they can be focused, they can express themselves. We have more questions, sir. Let me see who is asking another question. Dr. Prapanna Chaudhary is asking the question, what do you think will be the role of new age wearable devices that are coming in health tech, mind tech, non-invasive therapeutic to improve sleep, reduce stress, reduce anxiety? So here is the answer. They do have a role, no doubt about it. I am actually right now testing a device someone gave me. I know other devices also that people could wear. They have a role. There is no doubt about it. You can track your sleep. You can track your what is called heart rate variability, which gives you your stress levels. You know, someone was asking me, can you measure stress? Can you measure how calm you are? Yeah, you can. You can with a reasonable accuracy using heart rate variability. I know another company, a startup, creating a device to measure your EEG with one sensor only, one sensor on your body, you can measure your EEG, like how are your brain waves? Are you calm? Are you stressed? Are those beta waves, alpha waves, theta waves? You can measure those things and interpret how you're doing. So they do have a role. There is no doubt about it. But my other point on that is also that what wearable devices did we have all these hundreds of years? There are many doctors, many people who are able to safely, calmly, practically, take care of everything nicely. So it is so much about how we train ourselves, how we upgrade our skills. What is our mindset? How are we changing our behavior? Are we improving continuously? I think that is 90%. The wearable device, in my opinion, 10 to 20% probably is benefit. It's good to have it. There is no doubt about it. It's all right. You can wear it. But still, you got to change. We got to use it. We got to upgrade ourselves. So that is the answer for that question. Now, there is another question here, because we are almost 2 hours into this. So to be on time, we are going to close this out webinar pretty soon, but there are one more question here. So let me just answer that. Okay. 1 second. An anonymous attendee asks, recently a court held a surgeon negligent despite him explaining risk to the patient and attenders in written format. How to deal with it? I'll give you my answer. Let Dr. Lakshmi Devi answer that too. I mean, I think it is too broad of a question without knowing the details for anyone to answer properly. That is my perspective, but I'll let Dr. Lakshmi Devi answer that.
Yeah, actually, this is a very common question these days. And for a surgeon, most important is about the informed consent and a special high-risk consent for patients who have risk factors which are not normal, a video counseling if possible. So these things will help out. Also, explaining possible alternative therapies in the consent, the side effects individually, and the complications of the treatment. All these things need to be documented both in the outpatient as well as the inpatient case sheet. These will definitely add weightage to the documentation part and will be as supportive documents for the doctor. And coming to negligence, negligence is something where we say happens when there is a breach of duty and a damage happening. So there should be both of it. That means there is a breach of a duty which is supposed to be done, and there is a damage which happened. So those two things come under negligence, the definition of negligence per se in law. Okay, so here, if a patient had suffered due to that, so obviously they would ask for compensation, and that's what it is all about. So when the case is taken to the court of law, so the judge, being a non-clinical person, will depend on expert opinion. Okay, so the expert opinion could be anything from peer review. That means other doctors, clinicians who are experts in that field, who can support or refute the diagnosis or the treatment part. That is one thing. And whether the performing doctor, that means the doctor in question on whom the case was filed, acted in good, reasonable competence and with reasonable expertise. So that is something which is important. And the third point is whether clinical practice guidelines were followed or not. Okay, whether the commonly followed guidelines or protocols, as we say, okay, those things were followed or not. So these things are important to support the doctor's case. So that is something where that would help the doctor in order to fight for themselves in the court of law, and evidences in form of electronic or documentary All these will help in supporting the doctor. So I think negligence is a very commonly and abused word rather than actually having a meaning for it, which can be proved.
Thank you. Thank you. I appreciate the explanation and detailed answer, Dr. Lakshmi Devi. And thanks to Dr. Gopi Chen Daditota, my mentor, my well-wisher and friend, for joining this webinar. Thanks, sir. I'm seeing your messages. I appreciate that. Dr. Srihari Garu, do you have any final points that you want to make? The 2 hours of our webinar,
Yes,
and
sir.
want to, end the webinar with any special message to everyone.
Safe healthcare and practice and patient safety. Actually, we will discuss this purpose earlier regarding this. What is the betterment of our patient safety is the day, but our profession has to be benefited from this webinar. That's why we planned like this. And you are excellent and professionally well. Definitely, it is your talk will be useful to our members and other doctors also. So that's why we request our national president and secretary general and other members also. So, on behalf of IMA, I thank you for organizing this type of webinar and for this. You are definitely, I know you are an excellent even speaker and also you are doing a lot for the output. So for that thank you, and I request on behalf of our IMA to continue this type of webinars and in future also. We will cooperate with on the environment our doctors. So thank you for organizing this type of webinar, and thank you given opportunity for us to participate in this great webinar. Thank you, Kiran. Thank you.
You're very kind. Thanks for giving me the opportunity to able to collaborate. With your help only, we are able to do it, and I'm 100% ready for doing sessions. I think we need to continue
Yes.
important topics like this for both patients and doctors,
Doctors.
through doctors to patients. And absolutely, I'm always ready for it. Once again, thank you for your kindness, we have done. Dr. Lakshmi Devi, do you have any final message to people who are watching, to patients, families, doctors, friends?
So finally, it's a very interesting webinar because these are some of the aspects which we are facing day in and day out. And when we are discussing such things, definitely we all would agree with each other that we are all going through the same situations in life. Okay, and definitely it would help each of us to be more aware. And I think the involvement of the IMA president, vice president, and yourself from there, all these things are definitely a benefit for all of us who have attended this. And yes, it's a holistic approach basically. So here, the main idea of it is to come out of it in a comfortable, safe manner, not hurting anyone. So whether it is your techniques or whether it is the guideline or whether it is the quote. So finally, it is that we don't harm each other. That is the thing.
100%. Do not do any harm to yourself or other people. That's the essence of the message. And my final 2 words on this one is thanks to all the participants who have patiently been with us for the past 2 hours and listening to us and asking questions, interacting with us. We really appreciate you all. You all will be getting a bonus to your emails. It is a relaxation exercise as I promised. And also there is something called happiness formula that I discovered putting all the things that I have learned in my life into a formula, happiness formula. I will share that with you. And then the third thing is, my whole point is about how can I help our doctors, young doctors, practicing doctors, experienced doctors, no matter who they are, to have better life. Physician well-being is a big thing, you know. Let us save our own lives too while we save other people's lives. That's my message for all of you. And I also want to say something very, very important. I want to recognize the efforts of the team behind the scenes who helped us make this possible. First and foremost, thanks to Mr. Nageshwar Rao. He's the Karta, Kriya and Karma for this entire program. He said, Kiran, I think we should do this for World Health, Patient Safety Day. So why don't we do this? And then that is when I reached out to Dr. Srihar Rao Garu. And thanks, Nageshwar Rao, for being good friend and supporter. And then equally important, the team from Savitha, Mr. Venkatesh, Miss Lalita, and also Mr. Gaurav, and their supporting team behind, technical team and everyone, to create the posters and improve the awareness and try to push this out so that people can come and participate. I really appreciate your help. And also we need to thank our chief guest, Dr. Sharad Agarwal, for joining us today. Even though he was very busy in the airport, somehow he made it. And I also know that Dr. Anil Nayak, the Honorable Secretary General, he mentioned to me that he may not be able to, but he will try because he's in Delhi attending, I think, Dr. Narendra Modi's birthday, I believe. So thanks, sir. Even though you're not here, I'm sure your blessings are there with us. And also thanks to the IMA State President, Dr. Ravi Krishna, for his support and help. And once again, thanks everyone. And I wish you all good luck, good day. Wonderful. Bye.
Thank you and good day to you.